Psychiatric Q&A Part 5. 121. The nurse describes a client as anxious. Which of the following statement about anxiety is true? A. Anxiety is usually pathological. B. Anxiety is directly observable. C. Anxiety is usually harmful. D. Anxiety is a response to a threat. The answer is D. Anxiety is a response to a threat. Anxiety is a response to a threat arising from internal or external stimuli. 122. Which medication can control the extrapyramidal effects associated with antipsychotic agents? A. Clorazepate, Tranxene. B. Amantadine, Cimetrel. C. Doxepin, Sinequin. D. Perfenazine, Trilofan. The answer is B. Amantadine, Cimetrel. Amantadine is an anticholinergic drug used to relieve drug-induced extrapyramidal adverse effects such as muscle weakness, involuntary muscle movements, pseudoparkinsonism and tardive dyskinesia. 123. Francis, who is addicted to cocaine, withdraws from the drug. Nurse Ron should expect to observe A. Hyperactivity. B. Depression. C. Suspicion. D. Delirium. The answer is B. Depression. There is no set of symptoms associated with cocaine withdrawal, only the depression that follows the high caused by the drug. 124. When performing a physical examination on a female anxious client, Nurse Nellie would expect to find which of the following effects produced by the parasympathetic system? A. Muscle tension. B. Hyperactive bowel sounds. C. Decreased urine output. D. Constipation. The answer is B. Hyperactive bowel sounds. The parasympathetic nervous system would produce incomplete GI motility, resulting in hyperactive bowel sounds, possibly leading to diarrhea. 125. A client refuses to remain on psychotropic medications after discharge from an inpatient psychiatric unit. Which information should the community health nurse assess first during the initial follow-up with this client? A. Income level and living arrangements. B. Involvement of family and support systems. C. Reason for inpatient admission. D. Reason for refusal to take medications. The answer is D. Reason for refusal to take medications. The first star for assessment would be the client's reason for refusing medication. The client may not understand the purpose for the medication, may be experiencing distressing side effects, or may be concerned about the cost of medicine. In any case, the nurse cannot provide appropriate intervention before assessing the client's problem with the medication. The patient's income level, living arrangements, and involvement of family and support systems are relevant issues following determination of the client's reason for refusing medication. The nurse providing follow-up care would have access to the client's medical record and should already know the reason for inpatient admission. 126. Before helping a male client who has been sexually assaulted, Nurse Maureen should recognize that the rapist is motivated by feelings of A. Hostility. B. Inadequacy. C. Incompetence. D. Passion. The answer is A. Hostility. Rapists are believed to harbor and act out hostile feelings toward all women through the act of rape. 127. Andy is admitted to the psychiatric unit with a diagnosis of borderline personality disorder. Nurse Hillary should expect the assessment to reveal A. Coldness, detachment and lack of tender feelings. B. Somatic symptoms. C. Inability to function as responsible parent. D. Unpredictable behavior and intense interpersonal relationships. The answer is D. Unpredictable behavior and intense interpersonal relationships. A client with borderline personality displays a pervasive pattern of unpredictable behavior, mood and self-image. Interpersonal relationships may be intense and unstable, and behavior may be inappropriate and impulsive. 128. Nurse John is aware that the therapy that has the highest success rate for people with phobias would be A psychotherapy aimed at rearranging maladaptive thought process. B. Psychoanalytical exploration of repressed conflicts of an earlier development phase. C. Systematic desensitization using relaxation technique. D. Insight therapy to determine the origin of the anxiety and fear. The answer is C. Systematic desensitization using relaxation technique. The most successful therapy for people with phobias involves behavior modification techniques using desensitization. 129. Which nursing diagnosis is most appropriate for a client with anorexia nervosa who expresses feelings of guilt about not meeting family expectations? A. Anxiety. B. Disturbed body image. C. Defensive coping. D. Powerlessness. The answer is D. Powerlessness. The client with anorexia typically feels powerless, with a sense of having little control over any aspect of life besides eating behavior. Often, parental expectations and standards are quite high and lead to the client's sense of guilt over not measuring up. 130. Chris periodically has acute panic attacks. These attacks are unpredictable and have no apparent association with a specific object or situation. During an acute panic attack, Chris may experience A. Heightened concentration. B. Decreased perceptual field. C. Decreased cardiac rate. D. Decreased respiratory rate. The answer is B. Decreased perceptual field. Panic is the most severe level of anxiety. During panic attack, the client experiences a decrease in the perceptual field, becoming more focused on self, less aware of surroundings and unable to process information from the environment. The decreased perceptual field contributes to impaired attention and inability to concentrate. 131. Initial interventions for Marco with acute anxiety include all except which of the following? A. Touching the client in an attempt to comfort him. B. Approaching the client in calm, confident manner. C. Encouraging the client to verbalize feelings and concerns. D. Providing the client with a safe, quiet and private place. The answer is A. Touching the client in an attempt to comfort him. The emergency nurse must establish rapport and trust with the anxious client before using therapeutic touch. Touching an anxious client may actually increase anxiety. 132. Which activity would be most appropriate for a severely withdrawn client? A. Art activity with a staff member. B. Board game with a small group of clients. C. Team sport in the gym. D. Watching TV in the day room. The answer is A. Art activity with a staff member. The best approach with a withdrawn client is to initiate brief, non-demanding activities on a one-to-one basis. This approach gives the nurse an opportunity to establish a trusting relationship with the client. A board game with a group clients or playing a team sport in the gym may overwhelm a severely withdrawn client. Watching TV is a solitary activity that will reinforce the client's withdrawal from others. 133. Nurse John is aware that a serious effect of inhaling cocaine is A. Deterioration of nasal septum. B. Acute fluid and electrolyte imbalances. C. Extrapyramidal tract symptoms. D. Esophageal varices. The answer is A. Deterioration of nasal septum. Cocaine is a chemical that when inhaled, causes destruction of the mucous membranes of the nose. 134. The nurse understands that the therapeutic effects of typical antipsychotic medications are associated with which neurotransmitter change? A. Decreased dopamine level. B. Increased acetylcholine level. C. Stabilization of serotonin. D. Stimulation of GABA. The answer is A. Decreased dopamine level. Excess dopamine is thought to be the chemical cause for psychotic thinking. The typical antipsychotics act to block dopamine receptors and therefore decrease the amount of neurotransmitter at the synapses. The typical antipsychotics do not increase acetylcholine, stabilize serotonin, stimulate GABA. 135. Tony with agoraphobia has been symptom-free for 4 months. Classic signs and symptoms of phobia include A. Severe anxiety and fear. B. Withdrawal and failure to distinguish reality from fantasy. C. Depression and weight loss. D. Insomnia and inability to concentrate. The answer is A. Severe anxiety and fear. Phobias cause severe anxiety, such as panic attack, that is out of proportion to the threat of the feared object or situation. Physical signs and symptoms of phobias include profuse sweating, poor motor control, tachycardia and elevated BP. 136. Nursing preparation for a client undergoing electroconvulsive therapy, ECT, resemble those used for A. General anesthesia. B. Cardiac stress testing. C. Neurologic examination. D. Physical therapy. The answer is A. General anesthesia. The nurse should prepare a client for ECT in a manner similar to that for general anesthesia. 137. A decision is made to not hospitalize a client with obsessive-compulsive disorder. Of the following abilities, the client has demonstrated, the one that probably most influenced the decision not to hospitalize him is his ability to A. Hold a job. B. Relate to his peers. C. Perform activities of daily living. D. Behave in an outwardly normal. The answer is C. Perform activities of daily living. If a client can do ADLs, there is no reason for that client to be hospitalized. 138. Which of the following client statements about clozapine, Clozaril, indicates that the client needs additional teaching? A. I need to have my blood checked once every several months while I'm taking this drug. B. I need to sit on the side of the bed for a while when I wake up in the morning. C. The sleepiness I feel will decrease as my body adjusts to clozapine. D. I need to call my doctor whenever I notice that I have a fever or sore throat. The answer is D. I need to call my doctor whenever I notice that I have a fever or sore throat. Clozapine causes agranulocytosis and bone marrow depression. Early S/S includes fever and sore throat. The medication is to be withheld this time or the patient might develop severe infection leading to death. 139. A client was hospitalized with major depression with suicidal ideation for 1 week. He is taking venlafaxine, Effexor, 75 mg 3 times a day, and is planning to return to work. The nurse asks the client if he is experiencing thoughts of self-harm. The client responds, I hardly think about it anymore and wouldn't do anything to hurt myself. The nurse judges the client to be decompensating and in need of being readmitted to the hospital. B. The client to need an adjustment or increase in his dose of antidepressant. C. The depression to be improving and the suicidal ideation to be lessening. D. The presence of suicidal ideation to warrant a telephone call to the client's physician. The answer is C. The depression to be improving and the suicidal ideation to be lessening. Too obvious, no need to rationalize. 140. After 3 days of taking haloperidol, the client shows an inability to sit still, is restless and fidgety, and paces around the unit. Of the following extrapyramidal adverse reactions, the client is showing signs of A. Dystonia. B. Akathisia. C. Parkinsonism. D. Tardive dyskinesia. The answer is B. Akathisia. The client shows sign of motor restlessness, which is specific for akathisia or Makati-Sya. 141. Which of the following drugs needs a WBC level checked regularly? A. Alethine. B. Clozaril. C. Tofranil. D. Diazepam. The answer is B. Clozaril. Clozapine is a dreaded apical antipsychotic because it causes severe bone marrow depression, agranulocytosis, infection and sore throat. WBC count is important to assess if the client's immune function is severely impaired. The first presenting sign of agranulocytosis is sore throat. 142. The nurse judges correctly that a client is experiencing an adverse effect from amitriptyline hydrochloride, Elavil, when the client demonstrates a. An elevated blood glucose level. B. Insomnia. C. Hypertension. D. Urinary retention. The answer is D. Urinary retention. Elavil is an TC antidepressant. It should not cause insomnia. Hypertension are specific of MAOI antidepressants when tyramine is ingested. Due to the anticholinergic S/E of TCAs, urinary retention is an adverse effect. 143. After the nurse has taught the client who is being discharged on lithium, escalith, about the drug, which of the following client statements would indicate that the teaching has been successful? A. I need to restrict eating any foods that contain salt. B. If I forget a dose, I can double the dose the next time I take it. C. I'll call my doctor right away for any vomiting, severe hand tremors, or muscle weakness. D. I should increase my fluid. The answer is C. I'll call my doctor right away for any vomiting, severe hand tremors, or muscle weakness. This is a sign of light lithium toxicity. Increasing fluid intake will cause dilutional decrease of lithium level. Restriction of sodium will cause dilutional increase in lithium level. 144. A client is admitted to the hospital. 12 hours later the nurse observes hand tremors, hyperexcitability, tachycardia, diaphoresis and hypertension. The nurse suspects alcohol withdrawal. The nurse should ask the client. A. At what time was your last drink taken? B. Why didn't you tell us you're a drinker? C. Do you drink beer or hard liquor? D. How long have you been drinking? The answer is A. At what time was your last drink taken? This question will give the nurse idea when will the withdrawal occur. Withdrawal occurs 5 to 10 hours after the last intake of alcohol. This is crucial and mortality is very high during this period. Client will undergo delirium tremens, seizures and death if not recognized earlier by the nurse. B is very judgmental, C is non-specific, whether it is a beer or a wine it is still alcohol and has the same effects. D is a valuable question to determine the chronic effects of alcohol ingestion, but asking letter A can broaden the line between life and death. 145. A 16-year-old child is hospitalized, according to Eric Erickson. What is an appropriate intervention? A. Tell the friends to visit the child. B. Encourage patient to help child learn lessons missed. C. Call the priest to intervene. D. Tell the child's girlfriend to visit the child. The answer is A. Tell the friends to visit the child. The child is 16 years old, in the stage of identity versus role confusion. The most significant persons in this group are the peers. B refers to children in the school age while C refers to the young adulthood stage of intimacy versus isolation. The child is not dying and the situation did not even talk about the child's belief, therefore, calling the priest is unnecessary. 146. 60-year-old post-CVA patient is taking TPA for his disease. The nurse understands that this is an example of what level of prevention? A. Primary. B. Secondary. C. Tertiary. D. Nota. The answer is C. Tertiary. The client already had stroke. TPA stands for transplasminogen activator, which are thrombolytics, dissolving clots formed in the vessels of the brain. We are just preventing complications here. 147. The client is taking risperidone, Risperdal, to treat the positive and negative symptoms of schizophrenia. Which of the following negative symptoms will improve? A. Abnormal thought form. B. Hallucinations and delusions. C. Bizarre behavior. D. Asocial behavior and anergia. The answer is D. Asocial behavior and anergia. A, B, and C are all positive symptoms of schizophrenia. Negative symptoms include anhedonia, anergia, associative looseness and asocial behavior. 148. Preparing the client for the termination phase begins. A. Pre-orientation. B. Orientation. C. Working. D. Termination. The answer is C. Working. Telling the client that there is a termination phase should be in the orientation phase. However, in preparing the client for the termination, it should be done in the working phase. The nurse will start to lessen the number of meetings to prevent development of transference or counter-transference. 149. The patient complained of vomiting, diarrhea and restlessness after taking lethine. The nurse's initial intervention is A. Recognize that this is a sign of toxicity and withhold the next medication. B. Notify the physician. C. Check V/S to validate patient's concerns. D. Recognize that this is a normal side effects of lithium and still continue the drug. The answer is A. Recognize that this is a sign of toxicity and withhold the next medication. The nurse should recognize that this is an early S/S of lithium toxicity. Taking the client's vital signs will not confirm diarrhea, vomiting or restlessness. Notifying the physician is unnecessary at this point and the physician will likely to withhold the medication. 150. The nurse in the substance abuse unit is trying to encourage a client to attend Alcoholics Anonymous meetings. When the client asks the nurse what he must do to become a member, the nurse should respond. A. You must first stop drinking. B. Your physician must refer you to this program. C. Admit you're powerless over alcohol and that you need help. D. You must bring along a friend who will support you. The answer is C. Admit you're powerless over alcohol and that you need help. Rationale. The first of the 12 steps of Alcoholics Anonymous is admitting that an individual is powerless over alcohol and that life has become unmanageable. Although Alcoholics Anonymous promotes total abstinence, a client will still be accepted if he drinks. A physician referral isn't necessary to join. New members are assigned a support person who may be called upon when the client has the urge to drink.